All right. Hey ho, let's go. This is Resistance Radio, where natural selection selects resistance and public health tries desperately to keep up. Today, we are going to do three things: a rapid fire diseases or public health infectious diseases weather report. We're going to take a stroll through Congress's war on your circadian rhythm, and then a deep dive into how PEPFAR, one of the biggest HIV success stories in history, is quietly being undermined by policy choices. So let's start with the disease weather report. It's busy. And the headlines are, because there is a lot going on and none of it is boring. It is now starting with COVID-19, the summer sequel, right on schedule. COVID is waking up. Nationally, levels are low, but ER visits, test positivity, and wastewater is ticking up, especially in the Western US. Think of this like a blockbuster wave, more like that indie film that suddenly gets bigger audience than you expect. Each wave lately has been smaller than the last, which is good, but we're also far out from the last booster for a lot of people. So immunity is drifting. So if you're over 65 and skipped the spring COVID vaccine, this is basically the epidemiological equivalent of your calendar reminder. Now would be a smart time to catch up. Measles is on track to break a 33-year record. As of July 19th, the U.S. has reported 2,278 measles cases this year, already close to the total for all of 2025, with 5 months still to go. At this pace, 2026 is on track to set a new 33-year high. This is not just in more cases. That's a history level bad. About 96% of these cases are amongst people who are unvaccinated. And to visualize that, imagine a crowded bus with 100 people on it. 96 of them decided not to use the seatbelt. That's nearly 100% effective. Then the bus hits a very predictable pothole, and that's measles pretty much right now. We have some scattered outbreaks of measles. In Pennsylvania, there's more than 100 cases since April, and Utah has 12 straight months of ongoing transmission. Basically, endemic measles at this point. There are small clusters in Arizona and Wyoming that are currently percolating. So if your vaccines are up to date, you're in great shape. If you have an infant under 12 months near an outbreak, talk with your pediatrician about consideration of early vaccination. Let's move on to cyclospora, the mystery salad outbreak. Now to what might have been the most opaque, confusing outbreak of this year, which is, of course, cyclospora. Since May 1st, CDC has logged 4,173 logged 4,173 lab-confirmed domestic cyclosporiasis cases, plus more than 7,400 additional reported illnesses that are still under investigation. That's over 11,000 people with cyclospora-like illness, about 3 times a typical year. Picture a mid-sized college campus. Now imagine every single student having weeks-long relapsing diarrhea. That's the scale we're talking about. Several things are currently happening at once regarding cyclospora. There's a big multi-state outbreak linked to iceberg lettuce, with Taylor Farms to Mexico still being considered as the likely source in an FDA traceback. Michigan alone has over 6,100 cases linked to this outbreak, compared with over 50 in a typical year and more than 100 hospitalizations. And Ohio is over 2,000 cases and climbing. When we were talking earlier about kids under 12 months needing a vaccine early, I kind of coughed as I was just thinking about my son. All right. Investigators rely on patient interviews, shipping records, and distribution chains to pinpoint the source. A single false positive lab test on lettuce in Mexico led to some PR gymnastics, but the FDA still says Taylor Farms is overwhelmingly implicated based on the non-lab evidence. And here's the practical takeaway. If you're in the 27 states and the recall notices, avoid shredded lettuce or a shredded iceberg lettuce for now. If you're pregnant, over 65, or immunocompromised, be extra cautious, especially with fruits with a lot of folds, bends, crevices, because that's where parasites like to hide. So let's move on to Legionnaire's disease. Let's talk about the Manhattan outbreak. In New York City, a Legionnaire's outbreak in the Upper East Side has led to at least 4 deaths and more than 70 cases, with dozens hospitalized. Investigators trace Legionella bacteria to cooling towers on dozens of buildings in the area. Owners were ordered to drain, clean, and disinfect them. If you want a mental picture, imagine your neighborhood skyline. Now imagine the giant metal boxes on the roofs, the cooling towers, quietly misting bacteria into the air. That's what these outbreaks can do. That's why they're so sudden and why they're so widespread. The good news is that officials now believe the source has likely been eliminated and new cases are dropping. Let's talk about hantavirus, a fatal cluster in Venezuela. This is a new cluster of Hanta. This is not the one that's associated with the cruise ship. And this is located in the eastern Anzoátegui state in Venezuela. 3 people with confirmed hantavirus infection have unfortunately passed away, with 2 additional fatalities amongst healthcare workers in another state still under investigation. Hantavirus is often tied to rodent exposure, as we know. And while this is a small cluster numerically, the signal matters. When healthcare workers are involved and causes are unclear, obviously we pay attention. And that's something for us to be concerned about. So Ebola, let's talk about a tale of 2 countries. What's our Ebola outbreak? Well, right now it's giving us a split screen view of public health. In the Democratic Republic of the Congo, an outbreak of the Bundibugyo virus has led to more than 2,400 confirmed cases and nearly 1,000 deaths, with dozens of new cases and deaths reported in a single day. That's the equivalent of an entire small town being wiped out just by one pathogen. Meanwhile, in Uganda, there's good news. The last Ebola patient was discharged on July 16th, and the country has now started a 42-day countdown to declare the outbreak over. If they can go 6 weeks without new cases, Uganda officially becomes Ebola-free again. Think of the DRC as fighting a house fire room by room, while Uganda has just finished spraying down the last embers and is watching closely for smoke. All right, let's move into our second segment. Let's move from microbes to minutes. Let's talk about the Congress versus your own personal body clock. The Congress is closer now than it's ever been to ending a twice a year clock change. So the House just passed the Sunset Protection Act, which would make daylight saving time permanent. So that means darker mornings, but brighter evenings for 48 states. But here's the twist. Nearly every major sleep medicine and circadian biology organization recommends a permanent standard time instead. The science is really clear. Your internal clock cares about sunlight, not the number on your microwave. So deep in your brain, there is a nucleus called the suprachiasmatic nucleus, also known as SCN, and that uses light to keep time. Morning light is the strongest signal telling your body that this is daytime now. It helps set sleep, metabolism, hormone release, and darkness at night lets melatonin rise and sleep begin. Permanent daylight saving time shifts sunrise later by the clock, so especially in the winter. So what does that mean? In cities like New York, Chicago, Denver, San Francisco, you'd be looking at winter sunrises after 8:15. Imagine sending millions of kids to school in full pre-dawn darkness for months. This was tried actually in 1974, and the public support for this cratered once people started to experience this. So what are other things that we need to consider? When we spring forward, right, people lose about 40 minutes of sleep that first night, and we see about 6% more fatal car crashes and nearly 6% of workplace injuries in the following week. On the western edge of the time zones where the clock time is later relative to sunrise, people sleep roughly 19 minutes less per night and show higher rates of metabolic disease and some cancers in observational studies. So permanent daylight savings time is like giving the country a low-grade permanent version of the misalignment shift workers deal with, enough to nudge risk, even if the dose is smaller. Now, right behind the Sunshine Protection Act is another bill called the Sunshine for Our Kids Act, which would instead repeal daylight savings and make standard time permanent. So Congress is essentially picking a team morning light or team late sunset. From a health standpoint, standard time is much better. Match daylight saving is great for patio seating, but your SCN, that's that nucleus deep in your brain that can tell when it's light and wakes you up, doesn't actually really care about our happy hours. All right, so now for the deep dive, let's go into segment 3. Let's talk about PEPFAR, when a global success story becomes kneecapped. Now, PEPFAR is the President's Emergency Plan for AIDS Relief, and it's one of the most successful global health programs ever created. Since 2003, it's helped save tens of millions of lives, especially in sub-Saharan Africa, by massively expanding HIV testing and treatment. But recent Trump-era foreign aid cuts, delays, and program changes are eroding that progress, especially for children and those that are most at risk. So, in terms of what did the findings show, a new multinational analysis of PEPFAR data from 21 high burden countries found that US supported pediatric HIV treatment fell about 14% year on year. That's roughly 77,000 fewer children on treatment in the year of October 2025 compared with the year prior. Even when you count broader central support, national and subnational program funding, the shortfall is still around 5,500 children. And for scale, picture a modern football stadium full from the field to the nosebleeds with children living with HIV whose treatment support disappeared in a single year. That's the magnitude. The analysis is like this. Look at countries. The analysis essentially looked at countries where at least 2,000 children had been on PEPFAR-supported antiretroviral therapy. They found declines in pediatric treatment coverage in 21 countries, and they saw the steepest absolute drop in South Africa with about 30,000 fewer supported children, a 45% decline, followed by notable drops in Zimbabwe, Kenya, and Malawi. Now, research note that some children may have shifted to nationally funded or other donor-supported programs, but we don't yet have complete country-level data to prove those gaps were fully closed. And of course, the State Department's line is that falling pediatric numbers is a sign of success, fewer new infections, fewer children needing treatments, and there has been a 4-year downward trend. The authors, however, push back, pointing out that the most recent declines outpace historical trends in at least Uganda, Haiti, Zambia, South Africa, and Kenya. So when your curve suddenly bends more sharply right after funding cuts and stop work orders, it's hard to chalk that up purely to success. So key populations where services were cut. A separate survey by AMFAR of organizations receiving PEPFAR funds found that about 3/4 stopped providing services to populations most at risk. For example, sex workers, men who have sex with men, transgender people, and people who inject drugs. After the Trump administration policy changes. From a prevention standpoint, this is like trying to control a wildfire by refusing to send firefighters to the places with the biggest flames. You can do it, but the fire will happily exploit your logic gap. UNAIDS data shows nearly half of children living with HIV worldwide still lack access to treatment. Funding cuts and tighter, more restrictive policies around key populations have helped drive a sharp drop in HIV prevention services overall, with 40% fewer people receiving pre-exposure prophylaxis, that's PrEP, that helps prevent HIV in 2025 compared to 2024. And that's not mission accomplished. That's a widening gap. So what are some of the on-ground consequences in Kenya's Kismayu West? One of the highest prevalence HIV areas outside of Nairobi. A local health advocate describes what this looks like in real life. Fewer community support groups, new fees for tests that used to be free, and more children presenting with advanced HIV because early diagnosis and continued care were disrupted. So community care based systems that used to catch kids up before they fell through cracks haven't even fully returned, even as national government tries to train more staff to fill those gaps. That's the difference between a spreadsheet saying coverage is down 14% and a clinic where a child shows up hypoxic with opportunistic infections that were once preventable. So, in South Africa, the country with the largest HIV epidemic, the US has now moved away from supporting treatment efforts, leaning more on domestic funding. That makes sense long term, but when combined with abrupt international aid cuts, you get exactly what this analysis is flagging: steeper than expected drops in kids on therapy and gaps for key populations. So, how does this all fit together? If today's script feels like a lot: COVID bumps, measles, mystery lettuce, Legionella and cooling towers, hantavirus clusters, dueling Ebola trajectory, circadian politics, and PEPFAR cuts, that's because public health right now is a lot, but there's a pattern. When systems are funded, staffed, and allowed to follow evidence, we get Uganda's controlled Ebola outbreak and decades of PEPFAR success. When funding is cut, messaging is muddled, or politics override biology, we get cyclospore confusion, measles resurgence, and 77,000 children suddenly missing from treatment roles. Pathogens don't care whether you're tired about hearing about them. Your body clock doesn't care what time Congress prefers sunsets, and viruses definitely don't care which ambassador gets confirmed. Public health is most powerful when it's predictable, and when it's predictable, it's preventable. This is Resistance Radio, where natural selection selects resistance, and we try to make sure it's ours, not the microbes, that remains resistant. Stay curious, stay kind, and for now, maybe skip the shredded lettuce. And also, let me just say, while I was preparing this script, I had a comment about Senator John Cornyn pushing up against an ambassador and would not allow him to be approved if he did not release PEPFAR funding and data associated with it. That's why that comment about an ambassador just showed up. Anyway, thank you for tuning in. Bye-bye.